it going? It's Dr. Greg Marion here at One Spine Chiropractic. Today's topic of discussion is scoliosis and how we treat scoliosis here at our office. So let's give you a little overview of what scoliosis is. So from your spine, from front to back, you do not want any curves in your spine. So when you do have scoliosis, typically you have a curve either in your thoracic spine or maybe even curve in your lumbar spine, which is your lower back. A lot of times you might even have a tertiary curve up top in your neck where it's compensating, because what your spine wants to do is keep you midline as much as it can, but more importantly, keep your eye level into the horizon. So what we do is when we have scoliosis, first of all, we'll start probably more importantly with thorough history. So we want to see what's been going on with your spine, what you've been feeling, what you're doing, but also get some familial history as well, because a lot of times scoliosis is congenital and a lot of our family members pass it down to female members of the family and so on and so forth. So we'll start off with a thorough history here at the office. Second thing is we're going to do a comprehensive chiropractic examination to evaluate what's going on, how severe it is, and what we need to get things feeling better. So with a comprehensive evaluation, we'll begin with some posture analysis that are all computerized to evaluate how the shoulders are sitting, how the hips are sitting, how the pelvis is sitting, make sure we're not too far off, and if we are, we'll have some baseline data to work with as we're correcting you. The second thing is we'll do a Adams test. That's an orthopedic test that tells us if we have any curvature of the spine. We would typically have some rib humping on that area of the spine. So what we're going to do is evaluate that area to make sure that there's no rib humping. If there is, that's a positive sign. So we do have rib humping. The next and most important thing we're going to do is take some x-rays. X-rays are really important because that takes all the guesswork out. It tells us what the spine looks like, but more importantly, we are able to use a measurement called a Cobb's angle to see how many degrees of curvature your scoliosis is. Mild curvatures typically go from 0 to 20 degrees. Moderate curvatures go from 20 to 40 degrees. Then some severe curvatures are above 40 degrees on the Cobb angle. So with above 40 degrees, it might be a surgical option. 20 to 40, there's stuff we can do in office or not prevent bracing, start early, okay? Typically the curvatures we work with are from 0 to 20, which we can get quite a bit of change throughout. So what we want to do is do a thorough evaluation, take the x-rays and make a thorough game plan to get you feeling better. Once we have evaluated the x-rays and have a game plan, our primary thing to treat scoliosis is going to be the chiropractic adjustment. That chiropractic adjustment helps us get some bones back in place, because with scoliosis, you typically have a curvature, there's fixation, bones get stuck, they tend to cause pain, inflammation, irritation. So what we want to do is start getting some motion back in the joints to free up the nerves, free up the bones. And as we're retraining them, we're going to be pushing things back over on the convexity side, back where we need to, and also working above and below the concavity side to get those lined up properly. So we're going to do a specific adjustment according to what we find on your x-rays. Once we get you adjusted regularly, we may even use some muscle stim and heat. What that does, it helps us loosen up some of these muscles that have been so tight for so long, causing things to compress and curve. So that muscle stim and heat will let the muscles relax, get things feeling better, get some more motion in there for us. Another thing for some advanced cases, what we do treat here for degenerative scoliosis is we do some spinal decompression. That spinal decompression allows us to separate these vertebrae. Typically, if you have it in the lower back of curvature, we'll put you on a machine that'll stretch your lower back and help get that spine strain out a little bit, but more importantly, it'll free up the impingement of the disc and the nerves, causing some pain you might be experiencing. A lot of our patients with degenerative scoliosis might have some sciatica, some radiant pain, numbness, and tingling down that leg. So with that spinal decompression, that's going to be the best option to get everything healed up properly. Once we get things feeling better, once we get things a little more structural straight, another thing we do here in our office is do a comprehensive rehab program here in office, but also things to do at home for you. Because what we want to do is we want to make sure as we're getting things strong and straight, we get it strong so it'll stay there for long term. We don't want to get you feeling better for a little bit and get things straight for a little bit. We want to get things straight as we can, get things strong and stable. That way you have long lasting results. So like we talked about, we'll give you things to do it here, but also to do at home. Maybe send you home with a Scoliosis roll or a neck orthotic that might help you work on some posture curvatures that we need, and also kind of work on you kind of stabilizing that spine and get everything nice and neutral to have long-term results. So if you have any friends or family members that might be experiencing scoliosis, or you're concerned what scoliosis symptoms look like, things you can look out for is, especially with young kids, is make sure one shoulder's not higher than the other. Make sure that their pelvis is lined up properly. You might even notice when they're playing or running or walking that their gait's not off or they have a little hitch in their step. So there's things that you can look for on your kids, friends, spouses that you might be concerned about. But more importantly, if you do have some concern, call our office. We're very thorough here. We work on corrective care to get that problem corrected and fixed. So our office is One Spine Chiropractic, and we're here to help. Thank you.